Hi, everyone, and welcome to the Myopia Management webinar, where we're going to learn about protecting your child's vision. In today's webinar, what we would like to do is that we want you to have an understanding of what myopia is, why it matters. We want you to learn how to spot early warning signs. We want to teach you a little bit about the treatment options. And then all of this information can be useful for you to create your own personalized action plan to do the best that you can for your child.
Hi, it's Dr. Gall. I'll be talking about myopia and nearsightedness. What is it? Well, when you have myopia or nearsightedness, you can see up close, but really blurry far away. So the nearsightedness, again, is blurring the distance. It's kind of the opposite, but you see better up close. It begins in childhood and often gets worse with time as a child grows. And then we have Sarah's story. She came with her parents. The parents thought she was a little bit tired, squinting a little bit. And then we found out she had some myopia. And then she didn't have to sit so close to the board. We gave her some standard glasses, and we used some atropine drops at nighttime to control her growing myopia. And about 2 years later, as we followed up every 6 months, 2 years later, she was still even and hadn't changed. So the myopia management worked.
So how does your child's vision develop? So one thing I like to share is to say to parents that you know that your child is born with legs, but they don't know how to walk. And I think that that's a very tangible process when we get to learn to watch a child learn to walk. That same exact process happens with vision. It's just that it's not equally visible. And so what happens is that as the child is growing, their body's growing and their eyes are growing with them. And we want all of these systems, the vision, the child, the brain, to all be in balance as they grow with each other. What happens is that most children are born ideally farsighted, which means they see better far away than up close. And as their vision develops, they slowly start to lose some of that farsightedness. But we want to make sure that they don't lose too much of the farsightedness. Another way to try to understand it, because it can be a little bit complex, is I like to give the example of the algebraic numeric line, where the plus signs is where we're farsighted, and that's where we want the children to be born at. The 0 point is the people who don't need any types of glasses. And the minus side is the people who then eventually become nearsighted. So if we use that analogy to how children are developing their vision, we want them to be born on the plus side somewhere around 3 or 4. And as they're growing, right around the time that they're between 7 to 9, we still want them to stay on the plus side, ideally like a +1. We don't want them to shift over into the minus, because that's when they become nearsighted. So think of it, in that kind of analogy that I like to explain it.
All right, so grab your workbooks, and we're in section 1. We're going to help you identify risk factors for your children who may be at risk for getting myopia. So there's myopia is becoming a worldwide epidemic, and it's because of a few risk factors: increased digital time, less time spent outdoors, and a push for early academics and reading. As you can see, they're predicting in about 25 years that half the world will be nearsighted and 10% at a very high level of risk. Here are the risk factors. It has to do with your if you're a parent who is nearsighted, if you're nearsighted, your child's at a higher risk for nearsighted, higher risk even with both parents are nearsighted. Ethnicity, excess near work, less outdoor time, and the earlier you get it, the faster it progresses. And how do you know if your child is getting nearsightedness? When you look at them, they look pretty normal, but you may notice a few things, that they're squinting, headaches, particularly looking at distance, avoiding distance tasks like sports, holding their schoolwork too close, trouble seeing the board at school, and rubbing their eyes for better vision. And hold the books closer than usual.
So now we're in section 2 of your workbook, and we want to go over the impact of the nearsightedness and why does it matter. And so what happens with why we're concerned with the nearsightedness is because the eye is growing. And again, I love giving examples, and the example I like to give to try to get the understanding of this is, think of it that when you're not nearsighted, the inside lining, which is the area of the eye that we see with, is made up of about the same number of cells. And when you're not nearsighted, that lining matches up with the size of your eye. So think of it like, you're a size 4 and you're wearing a size 4 dress. As we become nearsighted, the eyeball itself becomes bigger, but the lining is still made up of the same number of cells, so the lining gets stretched. So now think about it like you're now a size 6, but you're still trying to wear that size 4 dress. We can know that the tissue or the lining of the dress would pull, stretch, and that same kind of dynamics happens to the inside lining of the eye. It gets pulled, stretched as the eyeball physically becomes bigger, but the lining stays about the same. So to cover a larger surface area, we worry about it. And of course, keeping that analogy in mind, now I become a size 8 and I still try to wear the same size 4 dress. Eventually that dress is going to tear. And that's the same thing that we worry about with the nearsightedness. We're concerned about the long-term consequences, even if we're not seeing them right now in your child. As your child becomes an adult, that's what's going to put them at risk. These thinnings of the inside lining, which we call the retina, can lead to degenerations and other conditions which are blinding potential. And so we see that with this. This is just more of that explanation, but more from a picture point, that the eye is physically bigger. The bigger that the eye gets, the greater the risk of developing the thinning and the degenerative types of sight-threatening conditions.
Thank you, Dr. Lorenzana. I often use the pizza dough, trying to make an extra large pizza out of a small pizza dough. It just thins out and has risk for thinning. Absolutely.
I like that one.
I agree. So next, we're into the basics, beyond basic glasses, section 3. These are treatment options. So glasses just aren't enough. Correcting vision with the glasses, but it doesn't slow down the change in the growth of the eye and the increase in myopia. It's like treating the symptom, but not really the root cause. So we have 6 main treatments to know about, and we'll also talk about how they can work together. There they are. There's glasses, special contact lenses, some eye drops, red therapy, and also some brain-based vision therapy. First is the glasses, specialized glasses. These aren't standard glasses, they're special. You can see in the rings of distortions in these glasses, and really affects the side vision. But it's really easy to just put them on, and it slows the progression of myopia. On the next slide, we'll talk about how optical solutions help slow the progression of myopia, whether for glasses or for contact lenses.
And then I think maybe just pointing out on this particular one that this Dr. Gall is in Canada, so this is currently available, a device that's available in Canada. It's still not yet available in the US. Hopefully soon to come.
Yes. There we go. So in the upper left, the red ring, it shows the eyeball and shows the tree getting focused on the back of the eye and showing that it's getting focused when the red ring outside the eyeball optically. So the peripheral focus is behind the retina, and that's a stimulus for the eyeball to grow and for the retina to keep up and get thin. On the right side in green, you see a green circle, and you see some special optics in front of that eye in yellow. And that's the peripheral focus is at or in front of the retina, which really puts the brakes on the eye to grow. So when we think of the optical solutions for glasses or contact lenses, this is what's happening. We're changing where the world falls on the peripheral retina. Instead of behind it, it's on or in front of the retina, which puts the brakes on growth.
And another modality that can be used for the control of the nearsightedness is soft contact lenses. And when I talk to parents, I always tell them soft contact lenses are actually a really great therapeutic tool, and not just for nearsightedness, for any type of condition that we may feel that the child will benefit from it. Unfortunately, I feel that in the market, they've been, kind of misrepresented, that they're only for cosmetic purposes. And so that's the one thing of a myth that I want to parents, for you guys to know, is that we're not doing contact lenses for cosmetic purposes. We're using them as a therapeutic tool and device. And so very often, don't worry about the child's age, because when you look at it from a therapeutic tool, you need to think about it like any other therapy that you would do for your child. Your child needs an eye drop, you would do it for them. So with the contact lenses, that's one of the things that I like to do, is because it is a therapeutic tool, put the responsibility on the parent, put them in, take them out, manage them, take care of them. As the child gets older, the child will eventually learn to do that on their own, but I don't use age as a restriction for me. I love the opportunity that this is a really great tool. The other type of tool is a little bit more specialized. This is a tool where it's a rigid lens, and it works very similarly like braces or like wearing a retainer that straightens your teeth at night while you're asleep. So this is a hard lens that reshapes your eye while your child is sleeping to what it should be, the right shape for your child to see clear. It is more of a customized lens. It does require more clinical care. And, in the previous one, in the previous soft lens, I don't use age as a restriction. With this one, I tend to fall where it's more for the athletic kids, the ones that do swimming. This is a great consideration. And because this one does require a lot more handling, and the parent would still manage all of that, but I usually personally I like to use it more in the teens and tweens and the athletics. Another type of tool is an eye drop, and so this is a regular eye drop that we've used for many, many years for dilation. In the use of nearsightedness, we use it in lower concentrations. And so that's another very effective tool that the research is showing is an option. And, which one of all these tools becomes for your child, it really becomes on a case-by-case basis. It's something you need to discuss with your doctor. What's going to be the most successful for you based on your lifestyle and what your habits and what's going on with your child.
Yeah, and here's myopia management. This is a graph that describes the change over time. So there's a graph. This is speaking towards the atropine drops. And on the graph on the left side, red arrow going down is worse, meaning more myopia. The eyeball's growing too much. And on the horizontal on the bottom in blue is age and by years. And they all start at about a half unit. And the ones that are red are not using atropine drop. They're growing, their eyeball's growing, and they're getting more and more nearsightedness, which has those risk factors and more blurred vision. We can flatten it out almost with the atropine drops. We have a, over 60% control of keeping it stable and not changing. And most of the atropine drops and the special glasses and contact lenses have nearly the same effect like this. And then another therapy is a red light therapy. Easy, you wear these LED lights, glasses, safe, 3 minutes every other day, convenient, effective, and health approved by FDA and Health Canada.
And again, this is one item that we do use in the U.S., but it doesn't have the similar. It's not as readily available.
It's health safety approved, but not approved for myopia, but it's health safety approved. And so studies are coming out like this, which shows the effectiveness of it. And you can see that's the same graph on the left. Going down is worse, going across the bottom to the right in blue is time in years. And in the red oval circle, that's red light therapy, keeping the prescription really stable. When they get off it, the red lines, that's the washout period, they get worse. Or if they're never on it, they just get worse and worse myopia.
And then another type of modality that can be used is really, I think it's really important that you do bring your child to a doctor who, one, is used to dealing with children, because children have a different component to their development of their vision. And so one of the things that can happen is that they can have binocular vision disorders, where their eyes are not working together efficiently, and maybe the nearsightedness may be a secondary symptom or adaptation to the child compensating for that. And so it's really important to be able to distinguish between, is it, nearsightedness that it's really just how the eye is growing, versus is it nearsightedness that is how the eye and the brain are adapting to other underlying causes. And so in those situations, those are best addressed through the vision therapy type of treatments to really hit more at the root cause of the problem.
Yeah, combination works best. 80% of kids probably just need one therapy, one break, but some need two. And if you look at the red light therapy off to the right, all the red lines can go to the specialized glasses and contact lenses, and even adjunct with the atropine eye drops. And also atropine eye drops can go all the other ones. So in some cases, when they're the younger they are or the faster they're progressing, the more consideration for combination therapy to put the brakes on myopia development. We're on the next section of lifestyle modifications. These are kind of free things you can do in your environment to help your child to keep their eyes healthy. We want them outdoors an hour a day, lessen the screen time, and keep the reading distance at a wrist distance, nothing near the elbow or closer.
And so, go ahead.
Yep. And so we're talking about, and also take some breaks. We've talked about the 20-20-20 rule. Every 20 minutes, look far away at 20 feet, take 20 blanks and go back at it. You need good lighting, good nutrition, and good sleep.
So now we're moving on to section 5 of the workbook. And this is where we want you to kind of go through that and look at red flags that may be warning signs to kind of alert you of what may be going on with your child, like rapid change in their vision, as Dr. Gall just mentioned. If they have persistent discomfort, frequent headaches, or after visual activities, especially blur vision after they've been on their digital devices or types of things. And then when to seek help when you do notice these red flags. Definitely when you're seeing squinting, you're watching them hold their book closer than it needs to be. And then definitely when they're having, again, sudden vision changes and discomforts in their eyes. And so what happens, one of the things that happens very often is that parents might think, well, my child had a vision screening either at the pediatrician or they might have had a vision screening at school. And that is just what that is. It's a screening. It's not really the full comprehensive exam. And because your child's vision is developing, that's the other piece, that number one, you're not getting the full evaluation. And number two, you're also not getting the other piece of information that tells you that just because everything might be okay today, it doesn't mean it will be okay in the next 6 months. And so that constant continuity of care becomes really, really important.
We're on workbook section number 7. This is your child's vision protection plan, things that you can do to help protect your child. Schedule a professional evaluation for an eye doctor who cares for children, who is up to speed on the latest research and clinical care. Start your personalized care around the home and for your child, vision-friendly home for myopia, and regular follow-ups with your professional eye care doctor.
So we want to thank you for taking the time and taking the initiative to be here with us this afternoon, this evening. And as a sign of gratitude, we want to give you 2 things. One is going to be the child vision tracking chart, where you saw that graph where Dr. Gall was saying that as you go down on the graph, it becomes worse, and then it shows you over time. So you'll have that as an ability to be able to track what's going on with your child, how their vision is changing over time. And then we didn't go into significant depth of a lot of the things, but we did prepare an ebook. And for showing up today, you're going to get that very comprehensive, very detailed ebook. We'll be sending it out to you in your emails for attending this evening. It'll address frequently asked questions. We'll give you some nutrition tips. We'll also give you some lifestyle examples of what are those things look like for you to incorporate changes in your everyday things. And then finally, thank you very much for being here with us this evening. Dr. Gall, do you have anything to add?
Just a big thank you for your time and listening and offering allowing us to offer our best care for your children.